bet you all weren't expecting to see me, but hi, everybody. I am Carrie Goldsmith. I am the JDP coordinator here at the Herbert Wertheim School of Public Health and Human Longevity Sciences. Just wanted to, again, let everybody know that we are recording and we have an amazing panel today. We will be hearing from a panel of four current and just graduated graduate students here in a variety of public health programs. I want everyone to use their answers as a starting point for your journey in researching graduate programs and career paths that might be the best fit for you. For more information about graduate school, obviously visit the public health, our Herbert Wertheim School of Public Health and Human Longevity Science website, and also just be ready to listen, learn, ask questions. For more information, you can visit there's a planning your future tab at ph.ucsd.edu/undergrad. You'll probably get all this information in an email if you have not already gotten so. All of our panelists information and all the contacts can be found on the website on our news and workshops page. So everybody who's doing a panel today, who's on this panel, you'll be able to reach out to them, either LinkedIn. They've also got their email, so that'll be great. I just, again, want to remind everybody that it's recorded and this will be available later on the public health website. So first, I want to start off by asking our panelists. We've got four amazing panelists here. If you could introduce yourselves, I'm going to ask you to say your name, your degree, your area of focus within public health, what school or schools you've attended, and future career plans, and a little bit about your graduate school experience. So I'm going to just go in alphabetical order to start. So I'm going to start with Alec, and then I'm going to go. So we've got Alec, we've got Mara, Stephanie, and Deepti. We'll go in that order to start.
Perfect. Thanks so much, Carrie. I can't seem to turn on my video. I think I need host privileges.
I think you probably do. Let's see if I can give them to you. If not, I will. No, I can't. Who can?
Okay. I have.
Okay, fantastic.
Great. So hi, everyone. My name is Alec Halak. I'm a fifth-year public health MD PhD student at UC San Diego School of Medicine and Herbert Wertheim School of Public Health. The way that the MD PhD program works is that students do half of medical school, and then they leave to do their PhD, and then they return for the second half of medical school. So physician scientists are very much interested in both medicine and science, and they definitely want to do careers that incorporate both. I certainly found myself thinking while I was at college at the University of Arizona that I was going to kind of pursue medicine, much like my father, who's a primary care physician. But over time and kind of becoming more kind of cognizant of what I wanted in my career, I decided that doing a PhD and kind of having like formal academic training in a very specific discipline would very much align with my career goals. So after graduating, I moved to Washington, D.C. and did a 2-year postbaccalaureate fellowship at the National Institutes of Health, and also did a health policy fellowship with a nonprofit. So I find myself now as a fifth year, where 5 years out of 8, where I'm very much kind of deep into my public health research, about to start my dissertation, and my research interests broadly are in social media and health technology, health policy, workforce development, and just promoting health equity overall among Indigenous peoples. I'm one of the very few Native American kind of public health MD PhD students, I guess, at UC San Diego in the country, however you want to divide it. But I'm very proud of the representation that I bring to the school, but also the perspective. So I'm always challenging UC San Diego to go a little bit further. And I've been very much been able to be a full-time student, a full-time advocate, but also really enjoy my career every day that I move forward. So really excited to be a part of this panel.
Hi, everyone. My name is Mara. Thank you so much for having me here today. I recently graduated from UCSD in 2021 with my bachelor's in public health and my minor in business. I came to UCSD as a transfer student. Unfortunately, I was only there for 6 months because COVID hit. So the rest of my, year and a half was pretty much fully online. But, regardless of that, I still had a great experience with, all my classes being online. UCSD was really supportive, and I still enjoyed all my public health classes. In the beginning of my undergraduate career, I was actually pre-med and really interested in the field. And then, midway through my undergrad career, I realized I was slowly losing passion for medicine and decided that it was just not for me. And that's when I kind of started looking into other majors and other careers that I would be interested in. And it was actually at the grad school panel. So when I was a student, I attended an event like this where I learned about Master's in Health Administration programs and, developed a huge interest for that and connected with alumni after the event and learned more about the graduate degree. And that's kind of how that led me to applying to a Master's in Health Administration program. So I'm currently an MHA, a first-year student here at Columbia's Mailman School of Public Health. It's my first semester here. I'm liking it so far. And so, yeah, that's a little bit about my educational background. Some of the interests or some of the public health fields that interest me are operations. And so I'm really passionate about, bridging the gaps in healthcare and, providing accessibility to underserved communities and just being a leader in healthcare. So that's just a little bit about me, and I'm excited to connect with you all after the event as well.
Hi, everyone. I'm Stephanie. It's really exciting to see so many people here. So I graduated from UCSD in 2018 with a bachelor's in public health, and then I minored in psychology. And so then I started my master's in public health in the fall of 2020, which is a really interesting time to be starting a public health program. Everything was, online. And very COVID focused, and a lot of the interests that I went into as soon as I started my program were COVID related. I started working at a COVID testing center, and thankfully my interests were infectious disease. So it was kind of, right up my alley, and I got a lot of really good experience there. And so I'm not sure if I said this, I started my program at George Washington University in DC. So I graduated a few months ago, and my program was specifically global health epidemiology. And I'm really excited to talk about that program specifically too, because it was the only one that I really found that was a combination of, global health and epidemiology. And I was really struggling choosing a program between the two. And so I was really, excited to see that there was one that had both of my interests of global health and kind of the harder epidemiology in there as well. What I'm doing right now, I work at George Washington University in the School of Public Health, and I research HIV. I've always, throughout my career at UCSD and then at George Washington now too, I've always been really interested in research. I never really came in with a pre-med mindset. I think I kind of knew that that's not the path I wanted to go down. I was always really interested in research in that kind of field. So my interests along the way have changed quite a bit, but that's what I'm doing now, and I'm really excited to answer some questions.
Hi, everyone. I'm Deepti. I'm super excited to be here today and also with this amazing panel. Also super excited to see Stephanie. She was actually someone I worked with too at UCSD. I graduated in 2020, and then I took a gap year and I applied to medical school. So I'm actually an M2, or my second year of medical school here in Nova Southeastern University in Florida. Moved all the way across the country. I will say California is still better, but I graduated from UCSD with a bachelor's of science in public health and a minor in biology. So I was kind of similar to some of the stories we've heard so far. I started off pre-med but as a biology major actually. And I found myself not really interested, kind of losing interest, and I started taking public health classes. Actually, as and interested in making it my minor. And my first class, I knew right away. It was like my light bulb moment. I was like, this is it. This is where I belong. It reminded me why I was interested in medicine, that medicine really belongs to the people and what we do to them. So, and it's just whatever we do, we're doing it to help everyone around us. So I think that was the direction I took with it. And I kind of found myself back in being pre-med, but as with a more public health mindset, I think for me, and it does provide me a very different outlook from my peers, and the way I approach medicine. So I do think it is a great career if it is something that you're looking towards. And I think public health gives you an amazing way to approach it. So I'm happy to answer any questions about that or how I got here. But I'm excited to be here.
Thank you all so much for the introductions. I'm going to ask some questions now, and I'm going to start with Mara. And here's some big questions. I think public health is a lot about big questions. So here's a big one. Why did you choose a career path in public health? What drew you to this field, and why do you feel passionately about it?
Yeah, no, that's a really great question. Like I mentioned, I was pre-med, and so I feel like the first half of my undergrad career, I was just like focused on those types of classes like bio, chem, physics. And I was even like volunteering at the hospital. So I definitely knew like career-wise, I wanted to be in a hospital setting. But it was just at that point when I transferred to UCSD that I realized that it was just not for me. And so when searching for like majors that kind of aligned with my career goals, I stumbled upon public health, and like DT mentioned, like my first class, I just immediately fell in love with the coursework. I just felt like it was something I was interested in, something that I knew that I could, grow with. And so ever since that first class, I immediately switched my major, and like I mentioned, everything went online. So it was kind of interesting that the coursework that I was taking was really applicable because, we were learning about quarantine and isolating, and everyone, was required to do that. And so it was really interesting to see everything come to life, with every everyone being isolating at home, and unfortunately it was just interesting to see everything be applicable. And then I also knew that I wanted to further my education. So with my capstone classes, we were talking about professional development. So that's when I knew that I wanted to further my education and get a graduate degree, but I just wasn't sure if an MPH was, a master's in public health was something I wanted to do. I wanted to delve more into like the business side of things, because I did mention that I picked up a business minor. And so that's when I realized that I wanted to do something that kind of incorporated both public health and business. And that's why I chose to do a master's in health administration. So, why public health as a career? As I mentioned, like it's such an amazing field because it's not just one narrow path. Like you could do so much. You could do epidemiology, you could do medicine, you could do health policy. And so my interests kind of aligned with health administration. So I knew I wanted to be in a hospital setting, but I wanted to do more than just provide directly to patients. I wanted to still impact them, but not directly. And so that's kind of how I got to my interests and why I'm passionate about public health in general.
I love it. Stephanie, Deepti, Alec, do y'all want to jump in?
Yeah, I'd be happy to go next. I think very much to what was just said, I didn't realize how much public health kind of covered. I always thought, it's the health of the public, there's public health departments, there's public health officials, they respond to, outbreaks and epidemics, and, the stuff that you see most often is what you don't see, because if public health is doing a great job, you don't necessarily see anything because, they're preventing the spread of disease amongst the public. and kind of going through my courses at San Diego State and then UCSD, it was very clear to me that I can understand things like epidemiology and biostatistics, and be proficient or competent in them, but those necessarily weren't the fields where I wanted to spend my entire day, because I love working with people. I love being in a kind of a boardroom, a table, and really identifying issues, but also proposing solutions, because it's so easy to name a problem, but it's so much harder to find a solution. So what drew me to health policy, which is one of the kind of 5 core disciplines of public health, is this kind of frustration of the status quo. So when I took an implementation science class, one of the very first offered at SDSU, our professor told us how evidence that's generated from observational experimental studies, it's published, but then it sits on a shelf for about 16 to 18 years before it actually changes the way that we practice public health or practice medicine, or just, in any other discipline. So, I thought, if you kind of think about your core biology class, where people always say DNA to RNA to protein, and that initially very simple, just one arrow, one arrow, one arrow. I was very interested in what that looks like in public health, where you go from evidence to policy to practice from a very simplistic standpoint. But then, how can you accelerate the translation of evidence into policy? But then how can you use policy to influence practice? But how can you also make sure that when we put equity at the center of that work, equity means acknowledging that the need among different groups is not necessarily the same. So when we lift every group up, every group will have a different policy or a different way that looks like in their community. And that's the kind of cognizance that I bring to my work. And it's really rewarding, because UC San Diego gives you so many leadership and research and professional development opportunities that allow you to get that real world experience. And that's the best way that I personally learn. I could watch a YouTube video, but if I could actually get out there in the field, especially more so with some of the restrictions easing, that's where I really learn, and where I really find this kind of career very very glad that I chose it, or maybe it chose me. I don't know.
I can kind of speak a little bit next. But it's so interesting hearing, Mara talk about the business side of things and how that interested her, because for me, it was the complete opposite. I knew that is not what I wanted to do. I was not natural at any of that. It did not, it didn't come naturally to me. And so I think I realized that when I was really interested in my epidemiology classes, and some of my friends were saying the same thing that I said about, health policy is, oh, that just doesn't interest me. Oh, this is, it's so hard. It doesn't come naturally to me. And I realized, oh, maybe this is the path that I should go down, because I do really like this. And, just to echo what Alec and Mara were saying, the field is so broad and there's so many different things you can do. And a lot of people I work with now even started in one area of public health and throughout their career have moseyed their way into another topic. So I really liked that aspect of it too, because I liked a lot of different aspects of public health. And it was scary to me to choose a graduate program of, okay, well, if I choose global health and I decide that that's not what I want to do, am I stuck? Do I have to, stay in that field? And, the answer is really no. You can take all this, the foundational knowledge that you're getting and apply it. And so to kind of back up, what really got me interested in public health was kind of like what Mara and Alec were saying, but, health issues and the people who really need help with these issues. So right now I study HIV, and a huge focus of what we're doing is targeting ethnically diverse populations, geographic locations that don't necessarily participate in research. And that is so hugely important to me. And that's what really interested me. And that's such a focus of public health, where, a lot of fields, it's not a focus. It's not something that people really talk about as much. And so I knew I wanted to go into medicine. I knew I wanted to help people, but I also knew that I didn't really want to be a doctor. And so research in that way and focusing on, underserved populations, it's such a big focus of public health. And that's what really, drew me to it. And I started out at UCSD with a public health major, but kind of like what Deepti said, that first class, it really solidified, oh yeah, this is where I want to be. And I think the first day of class, we had to turn to the person next to us and start working with them. And it was like, oh, college is collaborative. And, this is what the field is. You really, I work with all different kinds of people all day long. And, that's really important to me too, is that kind of multidisciplinary aspect of public health. And I love it.
I'll add on just a little bit more. Like everyone was saying, public health, obviously, like the different classes, you can find yourself in a lot of different places and finding different things interesting. I think for me, as I went through all my classes, I struggled a little bit because I found everything interesting just because everything was just a holistic view, just looking at the world from a farther level. Up till then, in my biology classes, everything was looking at such pinpoint views, every protein, every catalase. And I guess it was nice for me to see everything on an upper level and kind of see how everything has its own symbiotic relationship with each other and how different things affect each other. And so it was during my third and fourth years, I kind of started to take up different types of research projects. So I took up a public policy class or a research class, and somehow the policy that I was working on again ended up being about providers and how they can provide, and like the effect that the policy they were trying to pass that year would affect patients and provider interaction. And somehow everything I was kind of doing led back to that. And I kind of wanted to do something that still wanted to do something at the patient level, because I was just used to going to the hospital. I volunteered in hospitals and I kind of loved that aspect, and I wanted to somehow combine them. And so I actually am in an osteopathic school. So they're very similar between MD and DO. It's just the school of thought is slightly different, and we look at things from a holistic perspective. And I think that really spoke to me, and it was kind of similar to the outlook that I approached public health and, the outlook that it taught me. And so that is what I'm learning here. I hope to be taking on a master's of public health through my school soon too, and kind of learn how to integrate that into my future, I guess, career path. I'm not too sure yet how I'm going to do that or what that will look like, but I do hope to do that in the near future.
Thank you so much, y'all. I'm gonna get to the next question. It's another sort of big question, but how did you pick your concentration within the field of public health? I'm going to start with Stephanie.
Sure. So I got my master's of public health in global health epidemiology. So I think, I mentioned before that I found the classes I was taking in my undergrad, public health, the global health focus, and then the epidemiology focus I found the most interesting to me. And so what I was looking for in a school was, one of those two programs. And I think what I found too was, just because a school offers a master's of public health does not mean that they're going to have the concentration for you. And it does really make, quite a difference. And for me, location was a big deal as well. And so DC has a lot of different opportunities, outside of the school. There's so many different, the National Institutes of Health, like Alec was saying that he came here for 2 years. A lot of people come here for public health related things. And so George Washington had a lot of different concentrations, which was also a big factor for me. If I decided, actually I want to kind of move over into maternal health, or, that was something that I could do. And so I was really looking at what most interested me in my classes and then what I could do for a career afterwards. So being involved in research, ultimately what, I'm still working towards this goal. I would like to be the principal investigator of research studies. And so I knew to do that, I would, one route that I'm kind of going on is to go get my master's. And then in a few years, I'd like to pursue a PhD. So I figured, okay, which research topics am I really the most interested in? And they all fell within that category. And so, I looked for schools that had those and stuff like that. So that's kind of, look at what is really interesting to you right now. You don't want to go into something that, you might be good at, but you have no passion for, because, public health is really different. So kind of find that little niche that really speaks to you and, look around to see what schools offer it and what ways they offer it and kind of the flexibility around that as well. That's what I did.
Thanks so much, Deepti. Alec, Mara?
I don't think I have much to say on this topic, because I think for me, I went straight into medical school and I want to pursue my master's in public health soon. And if I were to, I'd probably go towards epidemiology, just because infectious diseases and that class were probably some of my favorite classes at UCSD. But, I haven't gotten there yet, so I can't say that I can speak much on it.
Yeah, I'd be happy to at least share like a few sentences. I think what I really liked about, so in the joint doctoral program, which is the PhD program in public health here between UC San Diego and San Diego State, we have a epidemiology track, a health behavior track, and then a global health track, which I'm in. And, we share courses among all the tracks, but then we also can take electives from other classes. But at the core of each track are certain objectives. And what really drew me to global health was this really specific attention towards kind of administration of health programs in other countries, power dynamics, and how you really see this kind of stark disparity between high and low middle income countries in terms of kind of what's determined a priority, what's underfunded, what's mismanaged, and how you often even saw with the COVID-19 pandemic where high income countries immediately purchased the global supply of available vaccines and left other countries to fight for the rest. So I think that kind of attention to health and equity was really what drew me to global health. And each of my classmates have such a kind of similar commitment to global health, but also so many different interests. So I'm also learning from them every day as well.
Yeah, I guess I could contribute as well. So how I chose my concentration. So like I mentioned, I always saw myself working in a hospital ultimately, down the line in my career. I chose operations kind of just chose to delve into operations, kind of just looking at day-to-day activities and just the financial aspect of leading a hospital, because that's just kind of what interested me at the time and still interesting to me right now. But going through my program, I think there's just so much more that I'm still finding out about. There's consulting, and it's like where you're posed with like a question, or like, the feasibility of building a cath lab, like should the hospital build it, should they not? And I'm taking a class called case competition class, where we go into the logistics and are posed with cases and how we should approach certain solutions, and so I think maybe down the line I might be interested in consulting. There's also accounting and finances. So, there's just still so much and strategy even. So I'm just kind of open to other interests and careers at the moment. But for now, I think I'm still interested in hospital administration, maybe just getting an administrative fellowship after graduation, where you're not really an intern, but you're given projects that you can lead. And that's like after graduation, where you work with an organization for 2 years, and ultimately it's kind of like a fast track into like a management position at that organization. So that's kind of how I like chose and picked my concentration.
Thanks, y'all. Deepti, I'm going to start with you for the next one. What experiences did you have as an undergraduate that you found to be the most beneficial in your graduate career?
In my graduate career. I think, like I was saying earlier, I think I just have a different outlook and a different perspective that I can bring to the table. I am a medical student, so at the end of the day, we're all learning very different things, but having a holistic outlook is very different, often from your, very traditional pre-med students and counterparts. The way that I've been able to approach patients or just understanding, just having that extra understanding of health equity, transportation, things like that, that sometimes we take for granted, but because I've learned about them, really understood what those differences are, I think my perspective is probably what brings the biggest difference. Experiences wise, I think some of my favorite experiences in public health were, again, my health policy research course that I did. It was part of one of my capstones. And for me, I learned a lot about how limited medicine was and how much actually we as the government or public policy really influences medicine. And I think I learned a lot about how I would like to go forward as, a possible future physician, and how I would like to figure out what I could have, provide to my patients in a way that was useful to them, but also available to them. So I probably those. In general, though, I think everything that I learned in public health was actually very applicable in life for me in general. But in terms of my graduate school, I would say those things.
Thank you. Alec, then Stephanie, then Mara.
Yes, Carrie, can you please repeat the question?
I sure can. It was a long one. So what experiences did you have as an undergraduate that you found to be the most beneficial in your graduate career?
Ooh, okay. So I would probably say, let's see if I can get this technical camera back on. I am actually traveling per usual, and I am given a lecture at the Mayo Clinic tomorrow about health disparities in Minnesota. So it's very cold here. My hands are shaking. So I would say I had a very non-traditional path to public health at the University of Arizona. So I came in as a biochemistry major because I asked my father, hey, what do I put on my application? And he's like, well, put something that sounds cool. I was like, biochemistry? I picked something out of this list of like 120 majors. And he's like, yeah, pick that. I picked it. I changed within 3 months to neuroscience and cognitive science. Eventually picked up another major in molecular and cellular biology, minored in biochemistry. For a quick minute, I had a minor in computer science, but then realized that there were just 24 hours in a day. And in addition to doing kind of so many leadership and outreach opportunities, I had to let go. And I would say the most important experiences that I had that have benefited me in graduate school is my participation in the University of Arizona Blue Chip Leadership Experience, which was a 4-year leadership program that, I was initially kind of like the trainee. And then later on in my undergraduate training, I was the team leader, I was a student coordinator, and I really got to model those learning skills and knowledge back, but also being a tutor for students with learning and attention challenges at the U of A Salt Center, where I think just really having a strong kind of skill set in communication, and being able to engage with folks in a very constructive way has very much benefited me in graduate school, because you're always expected to present your research, present your elevator pitch, and you never know when you'll need it. So it's very handy for you to just have that in your pocket.
Well, Alec, that is so cool that you're doing that at the Mayo Clinic. I just want to say that was really cool to hear. I think one of my truly like the biggest regret I had in college was not being more involved in clubs, extracurricular things. I think I was just nervous to put myself out there and do it, honestly. And I think that's maybe one of the biggest things I would recommend, because the things that I did carry into my graduate career and, you know, in my life, like Deepti said, was the internships that I was able to be a part of. I did kind of through my psychology minor. They had it, you know, it might be set up differently now, but it was Psych 199, and you could do an internship experience and get credit for it. And that was, you know, I had so much fun doing that. I learned so much, and you know, you get those foundational learnings, I guess, you know, that you can take into, and it was something I could, you know, put on my resume as well, which I feel like each little thing like that I did helped me get to that next step. And the job I actually worked with Deepti, with Dr. Britta Larson, that relationship with her was also huge. You know, I think a big school like UCSD, you might think, you know, oh, I'm in this 350 person chemistry class, they're not going to know my name, you know, but really I do encourage people to reach out to their professors, especially in those public health classes and those fields that you really like. I never actually had Dr. Larson as a professor. She had a job posting. I reached out to her. I said, hey, you know, I really want this job. You know, please take me. I have no experience, but I'm super eager. And, you know, it worked out. And my relationship with her, you know, brought me to this panel. It brought me to you guys. It, you know, brought me to my future jobs and experiences. And, you know, that was huge. And so I think just getting involved, you don't have to be on the executive board of a club, or, you know, I think like Alex said, it can be unmanageable at a certain point, you know, but just, you know, go to a club meeting, go on an internship info meeting, you know, something like that, just getting involved and having those hands-on experiences that you can talk about and bring with you into, you know, the next step. I think it's been huge for me, and I wish, you know, I had more of them.
Yeah, no, thank you so much for mentioning that, Stephanie, because, you know, looking back, it was kind of difficult for me to get involved because everything was online. But the first 6 months, I was just, you know, adjusting to a 4-year institution. Like I was at a community college, was way different. It was the first time I moved away from home. I'm originally from Los Angeles, so I'm still like adjusting to San Diego. And so the first 6 months, I was like, you know what, I'll worry about that spring quarter. Spring quarter never came because it was online. We thought we were going to go on spring break and come back, and we never did. But yeah, I'd highly encourage you all to get involved with clubs, reach out to your professors. I did not reach out to anyone until everything pretty much went on Zoom, because then it was just easier. I didn't have to walk across campus. I could just like click on a link. And that's when I started going to my professor's office hours. Dr. Marquez, she was my capstone professor. Awesome. Highly recommend you take her. I learned so much in that class, and I went to her office hours and talked about, you know, grad programs and how I wanted to take a gap year. And, you know, she gave me a lot of advice. And aside from that, though, you know, I don't know if UCSC still does this, but like, I think they like send out mail, like emails, like with opportunities or, you know, stuff that you can get involved in, like the public health department does. And I applied to this small business outreach program where we used to call small businesses in UCSD, specifically like the El Cajon area, and inform them about COVID-19 protocols so that they could adequately like get the proper measures to like prevent the spread of COVID-19. So this was like at the very, very beginning of like when COVID-19 was still a thing. We were still learning about like what isolation quarantine information was and how they could also get, funding to like paid work leave. Like none of them knew that that was something that they could do. So I was doing that. And then that kind of aided me into getting a contact tracing position with the Los Angeles County Department of Public Health after graduating. So that I feel like that experience was literally like what I did as a contact tracer. It was a remote job, and I had so much experience talking to people like in San Diego that I definitely think I learned a lot of skills that helped me when I was a contact tracer. So yeah, like just put yourself out there, get involved. Don't be afraid. Like you have to step out of your comfort zone to learn. And so those would just be like a few things that I would suggest. Take advantage of your capstone class. Like everyone, it's like a 2-quarter sequence, right? I believe so. Fall and then winter. I can't remember, but yeah, I think you have your same professor for 2 quarters. And so that's like an opportunity for you to get closer to that professor and get a recommendation letter potentially from them. So yeah.
I
I
love
do
this.
want to quickly piggyback there and say that I know we were all talking about experiences that were great, but I will say, like, again, like, just try, because there are a lot of times where your experiences aren't great, but you learn that you don't like it. And knowing that is a huge power too, because I came into college from high school with just a broad idea of, things I've heard here and there. I didn't even know what public health was. I didn't know if medicine was what I wanted to do. And it was totally trial and error, figuring out what I didn't like, and then eventually finding what I did like. So just like keep trying, it'll find you.
I agree. That's amazing. Sometimes I tell students just like failure is learning too. And so with that, I'm gonna skip a couple of questions just to piggyback off the last one, because I think this is sort of a natural progression. So for the panelists who attended UC San Diego as an undergraduate, do you have specific recommendations for clubs or organizations students interested in public health can get involved in that would be beneficial for skills or resume building?
I think from a pre-med-ish standpoint, I don't think there are specific clubs that I can remember off the top of my head. There's obviously, I think it was Flying Samaritans that, used to go out to I think it was a mobile clinic near Tijuana, and they would provide care every once in a while. So there are things like that. But what I would like to say is your counselors. I loved my counselor. She gave me so much information. Every time I went in, I felt supported. I figured out what classes I could be taking. She helped me figure out, it's actually Dina, but she helped me figure out what courses I could be looking at, what professors I could reach out to based off of what my interests are. I think going to your counselor and just, again, like asking your professors, there's so much to learn, especially San Diego, kind of the hub of not just like medicine, like people medicine, but just medicine in general, or care, public care in general. I think there's so much you can do in so many different ways. I volunteered at a physical therapy office. It wasn't really anything I was super looking into going into, but I just thought it would give me a different perspective. So just reaching out, looking on the website, going through the different research professors, reaching out to them. Just sometimes I didn't even end up doing research with them. I just wanted to learn about what they did, and I would go talk to them. And so just reach out. Yeah.
Yeah, just to piggyback off of what Deepti said, the Health Frontiers in Tijuana, or HFIT, I just remembered I was actually in that class. I forgot about it because it was virtual. But if it's still in person, you guys should definitely, like, everyone should, explore that, because even virtually, it was just awesome to see. Like, we were taken to different like sections of the clinic, and I got to hear patients speak in Spanish and do activities. And, it was just such a an amazing experience, even online, even though I wasn't physically there. I learned so much. So definitely, put yourself out there, get involved, take awesome electives. Like you all have to take electives that you're interested in, I took so many that were that counted both as like a business minor requirement and my public health like major requirement. I think I took one or two. You could knock off both. Just really take advantage that you're in undergrad, because honestly, it's a lot of fun. Looking back, I was always like stressed to complete my coursework, but don't be stressed. It's an experience. You're not going to get it again. Take advantage of like all the resources out there. Again, like Deepti mentioned, like, reach out to Dina, reach out to the public health department, Carrie, like Eliza, they're all amazing. They're all there for you. Like you need to take advantage of them. It's not just about classes. It's about your experience in public health. Talk to your classmates, connect with them. You all are going to be professionals someday, and it's going to be amazing just keeping in touch with your fellow classmates. So yeah, that's all the advice that I would have as well.
Yeah, cannot emphasize enough what Deepti and Mara just said. I mean, I think I sent so many emails during college that, I was ghosted by a lot of professors, but that's okay, because the couple that responded are what mattered and will push you forward. And so, you have kind of this unique access to your professors now. And, I love that Mara just said your friends too. A lot of my friends in college were a part of clubs that, I hadn't really heard of. And so, go with them to a meeting, or, see what your friends are doing as well and kind of go with them, or, someone sitting next to you in class, they might have been a part of something that you might not have heard about before too. So yeah, just kind of reaching out to your professors and saying, hey, what are you doing when you're not teaching? What work are you doing when you're not teaching? And a lot of times they're looking for someone. And, I think that relationship is so valuable. Even if they're not hiring in that moment or need something at the moment, they'll probably think of you when they are. And something I'll add too is that I know a lot of us are not as privileged to, take on a free internship over the summer or volunteer. And, I was in a position where I needed a paid job. And so I was looking for those paid opportunities, and, they are out there. And so if that's something you need, they're out there, and it doesn't mean that you're going to get discounted from these experiences, because, so many of them are free. So, really looking for those too, if you need that as well, is huge.
Thank you. So next, I'm going to start asking some more technical questions. So what advice would you give students searching for a graduate program? There's so many out there. How do you choose a program that suits your needs?
I'd be happy to go first on this one. Every public health program in the country is amazing. They will train you to be a great public health practitioner. What matters is what program is the right fit for you, and is the institution the right fit for you, is the location the right fit for you, and all the other factors that are going to affect you in your day-to-day life. Because going to graduate school, no less going to graduate school and medical school, is a very stressful experience. And you have to make sure that you're not just choosing a place because you like one person or you like one class, but you really have to like a majority of a lot of things that keep you grounded and make you feel like you can succeed there. Do they have academic support services? Do they have student programming? Do they have cultural centers? Do they have a beach? I don't know, things are important to us. Things are important to me that may not be important to others. Is there a subway? Is there Raising Cane's? There are all these things where you may not think that they matter, but once you're there and they're not there, you're like, oh, like, why did I choose to come here? Especially thinking about weather. Can you tolerate the cold? Are you very adamant in being in the sun always and being, active and near a beach? So think about all those things and see if you can find a program that fits the majority of those criteria. And that will be, really good for not just you, but also you and your well-being.
I can really quickly add, I think I'm in a position where I don't have a specialized or a division of public health that I am pursuing. But when I was looking into medical school, I did want my experiences and my perspective to translate that way. At the end of the day, there are a lot of medical schools that are more traditional, focused on research, and there's medical schools that like to have public health programs, or that have, extra elective classes during your second or your third years, looking into either public health, equity, or some way or the other. So just kind of looking into, I did spend some time looking into the colleges that I was going to apply to, looking at their programs, what they offered, what I could take on, if not right away, but later, that I was interested in. So that was something that I definitely did, and kind of helped me narrow down my search, because research is beautiful. I applaud everyone who does it, but it was just not for me. I could not do it, and I wasn't looking forward to going to a school that did prioritize that. And so those were kind of the distinctions that I made when I was looking for schools.
Yeah, I think a big part of what I did was just going back very much to the beginning and saying, okay, well, what do I want to even do with this degree? What am I looking to achieve with it? And I mean, that will really narrow down your search from that point. What Deepti was just saying, that she did not want research, and so that rules out quite a few programs already. And if I wanted to do something more in public policy, there are specific schools that are really good for that, and they have specific programs. And so I think really thinking of, what is the point of spending this money, getting this degree? What is it going to help you do? And then you still might have to pick between a few, but then at that point, I think you're looking at, okay, well, what is most interesting? What is most fulfilling to me? Location was a huge one for me as well. Coming to UC San Diego, I grew up in New York. And so for college, I really didn't mind being that far away from my family, but I wanted to be closer now. My sisters were having kids, and I think priorities just shifted a lot too. And so, knowing kind of what your limits are. And I think college is a great experience to kind of learn from what you've already done too. Oh, I want to be closer. Oh, I can go to a new city, stuff like that. And I think also I would look at the curriculums of a lot of the schools on their website, and, for that specific program, concentration, everything, it'll say, here's an outline of, the kind of classes you're going to take, the timeline. And there were some that I would look at right away and say, that's not really for me. I'm not really interested in that. And some that I'm like, oh, I would love to spend the next, 2, 3, 1 year, doing that.
Yeah, just to echo what everyone just mentioned, I think it's really important to look at what you're genuinely interested in. A lot of the programs may seem similar, but like Alec mentioned, geographic location is huge. So moving to New York, I don't know if I'm going to be able to handle the winters. Temperatures are dropping, and everyone's like, if you think this is bad, wait till January. I'm like, oh, great. Like, I bought the heaviest jacket there is, and I'm still kind of cold. So, Stephanie, if you have any tips later, let me know. But yeah, geographic location is huge. I knew I wanted to come to New York because I wanted to widen my professional network here, because I know I want to go back to Los Angeles and ultimately work there. So I'm thinking of applying to internships in Los Angeles, because that's like a graduation requirement. So I can get my network also there, to kind of have like leverage between two networks in like the East Coast and the West Coast, to see like where, my interests may fall in the future. Who knows, maybe I don't want to go back to LA. And maybe go even, to UAE. I don't know. I'm just like thinking about that right now. But yeah, looking at the curriculum is huge, because you're going to take these classes. And if you're not interested in a few classes, then from the get-go that that program is just not for you. You're investing your time and money, and putting all your effort into this degree. Like, you might as well choose something that you'll gain like a huge skill set from. I would say this is something I did, and I think it really helped. LinkedIn is going to be your best friend. LinkedIn was my like fourth social media after TikTok, Instagram, Snapchat. Like I was on LinkedIn all the time, randomly connecting with others. And sometimes they would accept and sometimes they won't, but that's totally fine. And then I would find what they were doing and see like what schools they went to, message them. A lot of them did respond and I was able to connect with them, talk to them over the phone about their graduate experience, how they're liking their new jobs or like, you know, careers currently. And I think that helped so much. So talking to people who have graduated and also just current students in general. So I was actually choosing between USC and Columbia, and I spoke to students from both. And I think at the end of the day, yeah, it might be helpful to talk to students, but it really comes down to like your interest and where you see yourself. So those would be like my 10 cents. So yeah.
I love it. That's all really helpful. I think definitely knowing where you want to be is sometimes the most important for anyone thinking about being in New England or those in New York. Layers are your best friend. Um, so here's a question that was sent in by a student. Is it logistically possible to work while attending graduate school? What do y'all think?
I will quickly come in and say I think it depends on what graduate school you decide to pursue. I mean, Alec may have something different to say, but for me personally, I don't think I can manage anything other than school right now. I feel like a full-time student with a plus on top of that. But I guess it depends on what you are hoping to do as well on the side. I think if you are hoping to have school part-time as a medical student and have a full part-time job on the side, I can't say that it's very manageable. But you know, if there's something like tutoring that you want to do on the side once a week, I do think that, you know, depending on how well you know yourself and how well you think you can manage that. And you can always start a little bit later. You can take the first few months to settle in and then kind of go from there. But I think overall, not very likely, at least in medical school, but that could be different somewhere else. And Alec could have something completely different to say.
I bet he does.
I don't know what Carrie is insinuating for this recorded call. I would say that it's very program dependent. So at UC San Diego School of Medicine, students are strongly discouraged, if not barred, from taking outside employment. You know, training to become a physician is a full-time training career, a full-time training program, a full-time position, a full-time commitment to a life of service. When you're in graduate school, though, it is possible to be in a PhD program part-time and have, you know, a part-time or full-time career. Many of my PhD courses, especially those at San Diego State, were often from, you know, 5 to 7:30 p.m., 6 to 9 p.m. You know, I think often accounting for the kind of fact that, you know, some students historically have been, you know, full-time public health professionals already. Who have an MPH or a bachelor's or some other master's degree and are now seeking to advance their training with a PhD. So that certainly happens. But I think it's also what you define as work. So, you know, I very much value the impact of, you know, not just publishing papers, but also widespread engagement with community and dissemination and making sure that I'm very present in community, which is why I'm very fortunate that I do social media research, because it means, you know, that I'm not tied to a basic laboratory with rats and mice. Travel is just inherently kind of permissible with my kind of research program. And it's just all a balance. You have to find, again, what works for you, because some people can, you know, I was going to say some people can juggle, and I was going to say, like, I'm one of those people who can juggle, but like I can't actually juggle, but I can juggle figuratively. I can't juggle literally. So, you know, really find mentors, you know, find people who represent both sides, who did not work, who worked, but also realize that not being able to work for many students is a privilege. So, you may not always have the choice, but know that there are always going to be people who support you and can help give you the right resources to help you succeed no matter what you have to do.
From an MPH perspective, I think it's definitely a lot more feasible to have, at least part-time employment than when you're in medical school. I will say though that for my first full year, I was working full-time and as a full-time student, and it was the worst thing I could have done. And so do not, please do not do that. I think that's a huge part of my advice, because I couldn't focus on my job and I couldn't focus on my schooling as fully as I wanted to. And, ultimately my mental health was not as good. And so I think it is such a balance, choosing if I need or want to be working part-time, can I be a full-time student? Do I need to drop down to part-time for both? Kind of figure out what you can handle and what you need to do is really big. And I like what Alex said about reaching out, because people in your program, they're there to help you and they want to help you. And if you feel like you're also financially in a situation where, okay, well, I can't go to school if I'm not working, there are so many plans where you can be a part-time student and it's really not that much extra time, and it's not going to cost you that much extra money, if any extra money at all, to do that. So they'll really work with you for what you need to do.
Yeah, I think that was like one of the questions I was asking, current students in the programs before applying to graduate school. Like, is it feasible to be a student and work at the same time? A lot of them did not recommend it, and I could see why. It's a lot. You're taking a lot of classes. At least for my program, we're taking like 5 or 6 classes, and that's a lot. Like, each class is 3 hours. It's really draining. Even though we don't have classes on Fridays, I feel like it's still difficult. I can't imagine doing it. Some people can, and are, working part-time. I physically cannot, because I just feel like I am here to like get this degree, and I can't put myself into different situations. Like I just physically can't. However, there are students that are working with professors and can get like a grant, like a research fellowship. So there are opportunities that you can, find on campus, so you don't have to go out of your way. Especially here in New York, it's very difficult. You have to allocate a certain amount of time to like travel. You're taking the subway. You don't have the luxury of your car. I miss my car. But as for, so for my first year, a lot of, students did not recommend it. Maybe your second year you can, if you're doing like an MHA or MPH. It really just depends on your program. And it also depends on you personally. Like, if you're the type of person to complete all your work like quickly, then, be my guest. Like, you can get a job. But yeah, medical school, I don't know how that's feasible. But yeah, it really just depends on you. It depends on your program. And it just depends on your financial situation, I would say.
I love this. I think this is one of the questions that comes up for my students in the JDP a lot. It's just like, can I work? And yes, but no. Research positions, teaching assistant positions, things that are within either your program or your school that do not require traveling and are designed to work around the student experience, I think is, the work that we recommend, and that sort of, especially for doctoral students, that you're expected to do some sort of research experience, but working outside. Oof. Next question. What was your graduate practicum experience like? So for those of you who have had a practicum experience, what did you do and what was it like?
My phone's about to die, so I'm going to unmute my mic and give an answer. So in global health, you're supposed to go abroad and do a doctoral practicum, but because I started during the beginning of COVID-19, I decided to do it within the US, of course. And I actually moved to Washington, D.C. for about 2.5 months, and I did a workforce development practicum with the National Indian Health Board, a nonprofit health organization that represents the priorities and interests of the nation's American Indian and Alaska Native tribes. So I looked into the history of the Morrill Act of 1862, but then kind of connected this political history that involves the expropriation or seizure of Indigenous land to fund the American higher education system, but then weaved a narrative around kind of workforce shortages, underfunding of the Indian Health Service, and the modern day kind of health disparities that we see in Native communities, and then took all of that with a number of interviews and other methodologies and proposed policy solutions. And then at the very end of that, wrote policy recommendations or resolutions that were adopted by my doctoral practicum sponsor. So now those are used to guide their official advocacy in Washington, D.C. on a daily or weekly basis, while I'm back in San Diego doing my program. So it's a great way to kind of, have an impact, but then, go back into my training. And that, again, real world experience kind of gives you a kind of, a moment in the driver's seat and says, is this what I want my career to look like? And that's what the practicum is really designed to do.
In my graduate program, we have a practicum requirement, and then also they call it a culminating experience. So it's kind of like a sort of like the thesis of, my master's program. And so what I did was actually combine the two into one kind of big project, which is something that, some students end up doing if it's the same kind of project. So what I did was look at one of my mentors and professors had a company outside of George Washington where she did, she's a filmmaker. And so they were still having to, produce movies and TV shows during COVID, and it was on the fly. How do we stop people from spreading COVID on set, especially people on camera who they aren't going to be wearing masks most of the time and stuff like that. So she developed an air hygiene protocol. So it's, engineering controls like ventilation, a masking policy, measuring carbon dioxide levels. And so what I did was take that quantitative data and analyze it and look at what the onset transmission rates were. And then also I did like case study interviews with some of the people on each of the sets. So it was like a big mixed methods research study. It was like a case study analysis looking at, how effective was this protocol at reducing COVID. And I really liked it because it gave me a lot of different skills. It's the data analysis, the conducting a case study interview, having to submit to the IRB, which is a whole skill set in itself. And so that's what I did. And, it wasn't global health related, which at first I was a little disappointed about, but, all in all, it was giving me all of these skills that I now apply in my career, and can hopefully do some more global health things now that COVID has died down a little bit.
Yeah, I can jump in real quick. So, like I mentioned, this is my first semester. So our practicum, or they like to call it APEX, so Applied Practice Experience. I think this is bad, but yeah, I think that's what it's called, or that's what it stands for. So ours is dedicated in the summer of our first year. So this upcoming summer, the whole entire summer from like June pretty much to August, we'll be doing our APEX or practicum, and then come back and then present to our peers and faculty. So I'm interested in doing mine preferably in Los Angeles. So fingers crossed I can get something in LA. If not, I want to go back to California. So mine would be probably in operations, to see if that's actually what I want to do. And so just seeing the flow of like what a hospital would look like, day-to-day activities, maybe be like given a project that I could work on, improving patient quality. So that's pretty much what I would be interested in applying for.
I'm just a normal medical student. I don't have an experience in practicum. Hopefully, I can one day, but it was absolutely amazing to listen to all of your wonderful stories. So,
Hey, we've just got a few minutes left, so I'm going to ask one more question. So, what is your advice for students who are interested in graduate school but have a limited amount of research experience? Someone wants to apply, doesn't have a lot of research. What would they do?
I will go ahead and speak from the pursuing medical school side. I think dipping your foot in it is slightly important. It's not a make or break situation. I will say that. But I think at least in terms of medicine, it's just this idea of, do you understand what the research process takes, and kind of being able to translate that into medicine as well, because research is trial and error, but it's also about perseverance, and that's kind of what they want to see you bring to the table as a medical student as well. So I think even if you don't have the chance to like, you don't need to be published or anything of the sort like that. Obviously, those are great things to have on your belt, and it makes you an even better applicant. But just trying something. My public policy research class, I guess, was only a semester long, and I learned so much from it, but it wasn't like traditional wet lab type of research either. I think public health gives you the opportunity to really pursue lots of different types of research as well, as opposed to what we usually hear. And it doesn't always have to be very long. So I think it's one of those things where it would be nice for you to have, but it doesn't really deter you from being a good applicant if you don't have it.
I was in, my program with a lot of people who had never, they had no research experience at all in, public health or any kind of science. A lot of people who were not public health majors in college. And so, I think there's so much stress in applying that you're almost competing against all these people who, they're published in 3 journals and they have this amazing resume. And sure, there are going to be people out there like that, but I think, more than you think you do. And when you start writing your essays and, thinking about why you want to be doing that, going into public health, that carries so much more weight than someone who, just has a lot of good things on paper and they're not actually going to be a really good public health professional. And I think that's the really good thing about public health is it is that holistic view. It's valuable to come in as someone with a different kind of major or a different kind of background. And, I might not have research experience, but, I've been involved in these clubs and I've had this, work experience working with these types of people. And this is how I can apply it to public health. So it's really taking what you have and, not convincing someone that it can apply, but almost convincing yourself, no, I have what it takes to do this. And it doesn't have to be this kind of cookie cutter path that even if someone next to you has more experience than you might be better fit for that program even.
Yeah, definitely echo all of that. Comparison is the thief of joy. You can stand on your own record, your own experiences, put your best foot forward. Is it potentially, more difficult to be admitted if you don't have a publication? Sure. Will people still get admitted without a publication? Yes. The same can be said about research, test scores, GPA, and so on. But when you consider things holistically and realize that you are a multidimensional person who, does a lot of things, people realize that you can bring a perspective or you can bring something unique to the program. And that's, usually the case of, why you're admitted. So, don't try and be the mold, try and be the person who breaks the mold. And really, I always tell people, at least for medical school admissions, do things that you'll be happy you did, even if you don't get into medical school, because there's no reason not to.
Yeah, thank you so much for that, Alec. In terms of research, so I would say it's not the end of the world if you don't have any research experience. I mean, I was fortunate enough that I did have some because, I was still exploring if I wanted to do medicine. So I did have some wet lab experience. But I would say, it's your story, so you can craft it the way that you want it to. So you could definitely talk about skills that you got from different group projects, or if you worked in a certain area that you feel like those skills are still applicable if you had that same research experience, like they're the same skills. Talk about those. I think that's really important for you to like recognize the skill set and be able to elaborate on that. I think that's equally enough. Would it be a plus if you did have research experience? Probably. It's never too late not to. I mean, you could still reach out to professors. If you're planning on taking a gap year, that could be what your gap year could be focused on. But I don't think it's like a make it or break it type of deal if you don't have it. It's not like the end of the world. Like, it's okay.
I do want to kind of add on to what Mara was saying, the idea that you can still show the skills that you would have learned through research in other ways. And I think that kind of is the point, because a lot of times, obviously, having a publication is different because that's just numbers. But a lot of times, what schools are looking for is what have you learned through the research. They don't necessarily care, like, oh, like, did you make a groundbreaking discovery? Did you cure cancer? Like, realistically, we have it, but they're not really looking at that. They're more so looking at what you learned. Are you a team player? Do you have perseverance? How did you deal with conflict? How did you deal with a setback? And so if you have other experiences, even if it's like multiple, to kind of show that you've done those things and you know how to deal with those things, I think that speaks more volumes than just having a whole bunch of research.
Thank you so much for this really well-rounded answer. I think it was really useful to hear, that everything is a holistic view, especially when it comes to applications and figuring out where you want to go for grad school. So I just want to open it up for any last minute remarks that y'all might have about, what you would tell yourself now, as an undergrad. Like, what advice would you have for somebody thinking about graduate school, applying to graduate school, choosing a graduate school? Any last thoughts?
Definitely don't think that you have to do this journey alone. Reach out to people early and often, and also realize, like, if you have a mentor, they don't have to be your mentor for everything. So find a mentor find mentors that serve different purposes, and realize that sometimes, you'll really be talking to someone at this stage of where you are, but a few months later, you'll be talking to a different set of people. But really learn from their perspectives, take them up on anything that they offer you, whether it be connections or a coffee or just resources, because the more you can learn about a career path, the more informed you'll be. And don't be afraid also to reach out to people like Carrie and learning about the graduate program, because what's Carrie going to do? Carrie knows all the ins and outs of the PhD training here at UC San Diego in public health, but also Carrie knows every student in the joint doctoral program. So if you share your interests, Carrie might even connect you with several students. And think about what you can learn, not just from Carrie, but also the students, but also think about who the students can introduce you to, because maybe they have resources and connections that are relevant to your own interests. So don't be afraid to reach out, because the worst thing that can happen is you not hearing back. But there's so much potential for what you may hear back.
I think if I had to go back, it was kind of similar to what Stephanie said earlier, is you know a lot more than you think you do, and trust yourself in that process. There are so many people with so many amazing experiences, and it's easy to find yourself in that hole of comparing yourself and thinking about, like, I don't have this, or what if I had this. But the reality is your experiences are yours, and even if someone else had the same resume as yours, the experience that you had there is going to be completely different. And so what matters more is what you've gained from it and how you can speak to it. I think I learned this a little late in undergrad, was learning how to speak for myself and having my own elevator pitch, because it's just human nature and partially student nature to think that you haven't done enough, but realizing that I had done enough with the time that I had and my personality, and being able to showcase that was a huge thing. And so just learn to trust yourself and put yourself out there.
Yeah, I love what you both just said. I echo that completely. And I think another thing is, we haven't really said this, but it might turn out that when you're thinking about it, grad school might not be for you, and that's okay too. And, you might decide, I want to wait a year. I want a year to work. I want a year to breathe. I know getting out of college, thinking about getting that next job, I was always, what's next, what's next, what's next? And it's taking a minute, okay, I'm 22, I have time. It might seem like everyone's, off to the races and, yeah, in the comparison thing. But if you wait a year, if you wait 2, if you wait 10, it's the program's going to be there waiting for you. And maybe they'll have worked out a few kinks in their program along the way too. So it'll be even better by the time you get there. So just, it's your own story, no pressure, no stress. Just try to do what you need to do and what's going to be best for you as well.
Yeah, to just echo what Stephanie just mentioned, it's about you. It's about your career. It's about like what you want to do in the future. So just go for it if you feel like that's a great fit for you. If you find a program that you feel like is extremely competitive, and I could speak about this for myself, to be honest, and I am completely transparent about this, I did not know I was going to get into Columbia. I was like, okay, that's a reach. It's an Ivy. I'm not good enough. I don't think I'm extremely competitive, but I got in and now I'm here. So it's like, don't be afraid of applying to those schools because you're intimidated and you feel like you're not going to fit in. You don't feel like you're as competitive and have all these publications and have like a 4.0 GPA and stuff like that. Like the worst case scenario is they reject you and that's it. Or they accept you and you end up coming. So it's like, go for what you think and be confident in your application and your personal statement. It's not always about the stats, it's about telling your story. So you guys are all great. It'll work out. It's going to work out. Don't worry. And we're here for you. So I posted my email. I also have my LinkedIn that you guys all can connect with me afterwards. I'd be happy to talk with anyone afterwards as well.
Thank you so much, everybody. We are right at 6:30. I can't believe we finished exactly on time. Congratulations to me. I'm taking all the credit, but really thanks to everybody for sharing your experiences, for telling us about your sometimes circuitous path through undergraduate, through graduate schools. I think seeing these diverse perspectives is really important. So thank you all for sharing those.
Thank you so much for having us.